Okay, you're all set, Kevin.
Right. Good evening. My name is Kevin Quigley. I'm the Scholarly Director of the McKechnie Institute for Public Policy and Governance at Dalhousie University. We'd like to begin by acknowledging that we are based in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. Thanks to everyone for tuning in for our live stream this evening. This is our second panel on our COVID-19 speaker series. Next week, on May 5th, we'll be hosting a panel on the challenges of the pandemic, the challenges the pandemic poses for the Atlantic fisheries. The landed value of the commercial fishery in Atlantic Canada is over $3 billion. There are over 14,000 vessels and 80,000 commercial licenses. 90% of the 3,500 businesses are small. 85% are located outside of urban areas. COVID-19 has generated significant challenges with respect to addressing workplace safety, coordinating a response across the sector, and responding to the significant drop in demand at home and abroad. On May 12th, we'll be hosting a panel on COVID-19's impact on tourism in Atlantic Canada. The Atlantic region welcomes 7 million people to the region each year, which generates $5 billion for the economy. Experts are expecting a significant drop this year. For both panels, and as is our custom at the McKechnie Institute, we will be exploring the issues, options, and policy responses for those sectors. In addition to the upcoming panels, we have a collection of expert policy discussions on our website and YouTube channel, and we encourage you to view them and share them with your colleagues. For tonight's discussion, we're joined by 4 experts to discuss COVID-19's impact on housing. Housing is widely accepted as a key determinant of health and a fundamental human right in both the Canadian and international context. For some of us, COVID-19 means we go home and wait for the restrictions to be lifted. For many, however, it is not so simple. COVID-19 and quarantine directives have exposed many health, social, and economic challenges. Indeed, many find themselves in difficult circumstances with few choices, and the choices are not enviable ones. Widespread job loss, high levels of indebtedness, and income inequality have rendered many people unable to pay rent or make mortgage payments. Many COVID-19 related deaths have been concentrated in long-term care facilities, making the residents' homes unsafe for themselves and the people who support them. Finally, there's been a marked increase in domestic violence, exemplified in the most horrific terms here in Nova Scotia last week. We will explore these issues and others with our 4 experts. And as always, we will explore the role of government and policy, including reference to the government's national housing strategy. I'll introduce all 4 speakers at once, and then each will have about 10 minutes to provide opening comments. After our 4th speaker, we will invite questions from the audience. You can ask your questions by emailing them to mipp@dal.ca. That's MIPP, McKechnie Institute of Public Policy, mipp@dal.ca, or by commenting on the Facebook video of this live stream. We start with Shawn Harmon. Shawn Harmon is a policy analyst at the Health Law Institute and an adjunct professor, Department of Paediatrics, Dalhousie. He's taught in the areas of health innovation regulation, public health law and ethics, and human rights, with an emphasis on disability and cultural practices. Following Shawn, we have Jacqueline Gahagan. Jackie Gahagan is a professor of health promotion in the Faculty of Health at Dalhousie. She holds a research associate positions with the European Union Center of Excellence, the Health Law Institute, the Beatrice Hunter Cancer Research Center, and Healthy Populations Institute. She's also a founding fellow of the McKechnie Institute. Jackie's programs of health promotion research focuses on understanding and addressing health inequities faced among marginalized populations at high risk for poor health outcomes. She concentrates her efforts on the development of effective policy and programming interventions. Prior to joining Dalhousie, Jackie worked in public health at the municipal, provincial, and national levels in relation to harm reduction, HIV/HCV prevention, and tobacco use cessation. Following Jackie, we have Ren Thomas. Dr. Ren Thomas is a researcher, writer, and instructor passionate about housing, transportation, growth management, and governance in urban centers. Her research focuses on affordable housing and transportation, particularly policy transfer processes among practitioners. Before becoming an assistant professor at Dalhousie University School of Planning, Ren worked in a variety of public, private, and nonprofit settings, including the Ontario Growth Secretariat, University of Oregon, University of Amsterdam, Canada Mortgage and Housing Corporation, and the BC Nonprofit Housing Association. Her edited book, Planning Canada, a case study approach, introduces readers to planning and policy in Canadian cities. It won the Canadian Institute of Planners Award of Merit for Planning Publications. After Ren Thomas, we'll have Linda Wilson. Since 1984, Linda has been working for non-governmental organizations serving people in the margins of society in Halifax. Her focus has been with those who are experiencing homelessness or at risk of homelessness. Her social work career began as a frontline worker at ADSOM for Women and Children. Over the next 30 years, she's held the position of Executive Director at Phoenix Youth Programs, Homebridge Youth Society, and now at Shelter, Nova Scotia. She was also an adjunct professor at Dalhousie University School of Social Work for over 10 years. So with that, I say welcome to our speakers. Thank you to our audience for joining us. And I'll now turn it over to Mark Harmon, who'll get us started. Mark.
Hi, can everyone hear me okay? Good. Let me just share my... Great. Thank you, everyone. Good evening. So my talk is about the National Housing Strategy, a little bit background to that, or a little bit of its content. I want to contextualize that with the COVID-19 pandemic, and then talk about intergenerational justice as something to help us move the strategy forward. And in many ways, my talk is, will give you some grounding for the talks that will follow. It'll give you a little bit of background for those talks. So as Kevin already said, housing is a critical social determinant of health, and without adequate housing, we have multiple harms that will follow. Now, Canada has not done particularly well when it comes to social housing. We have aging and crumbling housing infrastructure that is not particularly energy efficient, is often not well placed with respect to public services. We have very uneven access to affordable housing, with certain groups consistently marginalized, housing stock that is unable to meet modern demands, particularly in certain cities and in certain parts of the country, with harms felt particularly acutely by the poor, the young, the old, and visible minorities. And we've long lagged behind other countries in developing reliable and robust housing data so that sound decisions can be made in relation to housing. And so it's against this sort of background that the National Housing Strategy was issued in 2018. And it was a very ambitious strategy looking to invest $40 billion in a wide range of programs. And again, a lot of it, there's a significant emphasis throughout the strategy on certain marginalized groups, including in particular women. And so the rhetoric of the strategy is that it will be a rights-based approach to housing and to design that prioritizes vulnerable populations, that it will apply an evidence-based and a collaborative approach to decision-making that engages communities. And so the whole thing is sort of wrapped around these three core ideas of people, communities, and partnerships. And the idea is that it will be a policy area that is more inclusive, more accountable, and more non-discriminatory than in the past, and that it will provide opportunities for communities to exercise some self-determination. Now, it calls for and relies on a range of new infrastructure. One is legislation, another is the National Housing Council, community-based tenant initiatives, public engagement campaigns, and the federal housing advocate who will monitor implementation and progress, undertake studies with respect to systemic barriers to affordable housing, and will prepare an annual report. And will be provided administrative support from the Canadian Human Rights Commission. So the National Housing Council has been delayed due to the pandemic, and I looked on the government website for the advocate, and all I could find was a call for applications. So that may also have been delayed due to the pandemic. What we do have is a National Housing Strategy Act. So that was passed in 2019 and came into effect in July of 2019. And it's really an interesting short piece of legislation. Section 4 entrenches legislatively the the broad approach to housing that is articulated by the strategy itself. And that is that it is a fundamental human right, that it's inherent to our dignity and well-being, and so on. And Section 5 imposes on the minister a variety of responsibilities, including setting long-term vision for housing, setting national goals and standards, and so on. And then the minister must respond to the annual report of the Federal Housing Advocate. And these provisions actually can be quite important if moving forward, if groups or communities feel that they're not being served by decisions being made under the housing strategy, then this gives them some pretty interesting and solid grounds to challenge decisions being made by the minister or by developers who are receiving funds through the programs. So this could be an interesting, an important piece of legislation. So we've got old housing stock, we've got new policy, and then on top of this was dumped the pandemic. And Kevin has already highlighted, I think, some of the key areas where the pandemic has created housing pressures and housing tensions for end of lease tenants who now find it difficult to find new accommodation, to people in institutional care who can't distance or who maybe aren't receiving the care that they should have been receiving, and this is being exposed. So there are all sorts of practical housing related implications of the COVID-19 pandemic. And then another common concern, which has been raised by this housing research collaborative identified on the slide, is that this could lead to predatory housing practices. So national and international actors could purchase distressed properties that would be more effectively used in accordance with the national housing strategy. And the concern now is that they may not be. And so they've issued an 8-point action plan as part of a statement which has been sent to the minister. So what does this all mean? So we have a national housing strategy that seems to say some of the right things. It has a legal framework that seems to be sensible. We have the longstanding problem, however, of our political response to both housing and to crises, neither of which have been designed to assist in any real way, sometimes, the needs of those populations that are most at risk. And we can think back to the global financial crisis and who gained and who lost as an example of this. So with respect to housing, prior to the National Housing Strategy, Canada's housing policy was very much a profoundly market-driven agenda, which was achieved in part by the government more or less extracting itself from new social housing commitments. And the demands of the financial sector were very much key in shaping this approach. And so this neoliberal approach became so ingrained that the problems thrown up by neoliberalization were then tackled through further neoliberalization. Now, this isn't an area that I would dwell on too much, other than to say that what it essentially means is that we took a privatization approach. And so instead of viewing housing as a social problem, it became viewed as more of a financial problem, and it was dealt with through securitization and financialization. Now, the danger, of course, is that programs developed under the National Housing Strategy will serve to benefit developers and remediators. And they have shown a reluctance in the past to get involved in affordable housing construction. There is little indication in the strategy as to what constitutes barrier removal and how this will be achieved. There are concerns that actions could result in poor zoning decisions or poor planning choices, and there are all kinds of examples in all of our cities of that. And there are concerns around the fact that building standards could be eased, that there could be urban development of land that would better be used for protected habitat or for urban green spaces or urban gardens. So, and these are all concerns that are thrown up by the way housing has been approached in the past. So we need housing to be viewed as a socially significant, justice implicating intergenerational investment, which helps communities that have historically and persistently been marginalized, but that also helps future generations. And we've been developing this idea that to truly realize the human right of housing in a sustainable and socially sensible manner, we need to think more deeply about, and we need to better operationalize a notion of intergenerational justice. Now, this is a concept that is pretty well known in the ecological and climate change setting, and it basically means that it suggests that we are custodians and not owners of the planet's resources, and we should pass them on in no less state than what we found them, which of course has not been done. But we don't need to limit intergenerational justice to that particular setting. And I think it is a profoundly relational concept that encourages connections and duties on behalf of others. And these duties would be felt laterally to generations that coexist now. At any given time, there may be 4 or 5 generations that coexist on the planet, and that are owed vertically upwards to future generations who we won't necessarily meet. And I think that intergenerational justice really is informed by or implicates 3 core overlapping notions, and that is partnership, solidarity, and responsibility. And it's just these ideas that society persists through time, and that we need to foster collaborative partnerships that serve the multiple identities that we hold, that humans are intimately connected, and that we need to take a much broader view of our moral obligations to each other, much broader than the law has typically imposed in the past. And finally, with respect to responsibility, that our polity is an intergenerational agent that exhibits great inequalities currently, and that even though we individually may not be blameworthy for those inequalities, we have an individual and a collective responsibility for achieving and maintaining substantive justice. And if we think of these 3 things in relation to housing, then we can, I think, better operationalize intergenerational justice in the context of housing. And ways we can do this is to think about a 4-point framework when we're making decisions in relation to this. Decisions that make us think about rights, duties, balance, and the future. And so if we think of balance, and again, in the context of a pandemic that's unfolding, if we think of housing challenges faced by vulnerable groups and felt more acutely by them during the pandemic, then key actors need to balance safety and public health measures with rights and maybe a broader notion of well-being. So it's these sorts of points that, if they're in the forefront of our thinking, can help us make better decisions, I think, or at least decisions that will at least give us a chance to think about the intergenerationality of what we're doing. And when we're building structures, public structures, we're certainly building things that will have an intergenerational impact. I'll just close by saying I think that attention to intergenerational justice in housing offers the possibility of ensuring that the strategy addresses in application some of the acute imbalances that exist between benefits enjoyed across communities and across age groups. I think I'll leave it at that. Thank you.
Jack, you're all set?
Great. Good evening, everyone. Bonsoir tout le monde. I'd like to thank the McEachin Institute for hosting this important panel discussing issues around housing on the brink, and for inviting me to be part of this session. And also thank you to Shawn for the great overview of the National Housing Strategy and the intergenerational justice framework as a means of moving this conversation forward. Before we get started with my talk, I'd like to acknowledge that I live and work on the unceded and unsurrendered traditional territory of the Mi'kmaq, and that we're all treaty people. Kevin has already told you that I'm a professor of health promotion, and that's salient to this conversation because you'll see I'll be drawing from some of the key tenets of health promotion in this presentation. And essentially what I'd like to cover in my 10 minutes of allotted time is just briefly discuss the notion of housing as a key determinant of health. I'm going to talk very briefly about our Social Sciences and Humanities Research Council funded study on a historically marginalized population that will help help illustrate this notion of vulnerability to poor housing outcomes. I'm going to talk a little bit about the policy gaps within the National Housing Strategy, and then I'd like to talk very briefly about gender-based violence in the face of COVID-19, and then some needed policy actions going forward. So we know that from the health promotion literature, as well as the public health literature, that housing is seen as a core determinant of health. And by that, I mean essentially that those who are homeless or those who are precariously housed experience worse health, social, economic, and other related outcomes than those who are housed in safe, affordable, and accessible housing. And we know that determinants of health intersect and differ by population and over time. And this is an important issue to keep in mind when discussing the current situation in COVID-19. It's also really important to think about this notion of vulnerable populations and to try and unpack the sort of verbiage that Shawn alluded to in the National Housing Strategy, where we see on the one hand, vulnerable populations being noted in that strategy, and those who experience those vulnerabilities range from a variety of historically marginalized populations. And so when we think about that concept of vulnerable populations, I would argue it's the systems in place that create those vulnerabilities, and we need to be cognizant of the fact that the policies and the programs that we put in place, including those in the housing sector, may in fact contribute to and further the vulnerability of particular populations. So again, I think we need to have a little bit more specificity about this sort of global notion of what creates vulnerability for particular populations. So as a result of this notion of not only housing as a right, and Shawn alluded to that in his talk, but also gaps in our knowledge about, for example, populations such as older LGBT Canadians, our national team actually undertook a one-year study looking at improving our understanding of the unique housing needs for seniors, so those who are 55 and older, who self-identify as lesbian, gay, bi, or trans. And the reason why this is particularly important in the National Housing Strategy is that we know that there are existing gaps in meeting the needs of these historically marginalized populations, and where that becomes particularly salient to policy discussions is we simply don't collect appropriate or sufficient data. And just for those of you who are not familiar with policy developments in Canada as they relate to LGBTQ2S populations, it's important to note that although Canada has a long history of implementing a variety of human rights legislation and policy directives and shifts over time aimed at protecting the human rights of LGBTQ2S Canadians, violations of these rights, including the right to safe, affordable place to live, still continue. And this, I will argue, this schematic, which is produced by the Public Health Agency of Canada, has already been widely contested within the community. So again, this notion of what creates vulnerabilities and what actually leads to positive health outcomes is an important thing to keep in mind when we're talking about these types of policy directives. So just shifting gears, as I mentioned, as a result of this dearth of information about the housing needs of older LGBT Canadians, we undertook a study to look at, with a group of housing providers, policy analysts, and others, to look at three key data points. And the three key data points were essentially a scoping review of international literature on housing policy to understand if and how they're actually meeting the needs of older LGBT populations. We also undertook a national survey to gather data from LGBTQ Canadians as well as housing providers. And we undertook a series of focus groups with LGBT Canadians to understand both their experiences as well as their perceptions and how best to meet their housing needs. And I'd like to note that this research grew out of our earlier work with colleagues such as Dr. Liesl Gambold from Dalhousie University, and we were funded initially through the European Union Center of Excellence to look at this work. Now, just very briefly, given the time that we have, I'm just going to speak very, very briefly, but I'd be super happy to follow up with folks about the data in greater detail. But just to give you a sense of who we heard from, we had 982 folks complete fully or partially the online survey, and you can see the breakdown by province. I won't go into that in great detail. We did see that the majority of folks who participated self-identified as white, 6% as Indigenous, and the remainder as other. And this is important when we start talking about the intersecting determinants of health and how those actually impact on health and housing outcomes. You can see the final point on this slide, which is a type of housing people are in by 39% in apartments, 30% owning a home, 13% renting a house, 10% owning a condo, 2% in co-ops, 2% in mobile home, others, 1% in public housing, etc. In terms of the focus group data, we did hear that there were a variety of issues that were salient to seeking and securing safe and affordable housing for our older LGBTQ folks. So to my earlier slide with respect to human rights legislation that had been produced in Canada to prevent issues of harassment and violence, et cetera, against LGBTQ folks. What we heard in our focus group data is that, in fact, the enforcement of those legislative and policy positions are seriously lacking. The scoping review, as I mentioned, includes a variety of international papers and publications and research. But what we found in the 176 publications that were included in the scoping review, that the vast majority of them were descriptive in nature, and very few of them actually talked about specific housing interventions that could be scaled up and used more widely. In fact, there was a very limited focus on system-level solutions to meeting the housing needs of this longstanding vulnerable population. Now, switching gears again, I just wanted to go back to the National Housing Strategy and remind folks that two of the key goals of this National Housing Strategy are to reduce homelessness and to increase housing affordability. And that's important to keep in mind. But as we've seen in the situation we're currently in with COVID-19, vulnerable populations tend to be hardest hit. That's not a surprise, I'm sure, to most people. But the high cost of housing, the lack of affordable options, plus the notion of self-isolation at home has created, if you will, sort of the perfect storm. And this perfect storm actually places already vulnerable populations at greater risk for gender-based violence. And I would argue that there is an urgent need, an immediate need to look at long-term policy responses that consider intersecting determinants of health, such as age, gender, location, etc. And what we don't know at this point in the pandemic is how COVID-19 is directly impacting on, for example, older LGBTQ folks. The timing of our study was that we didn't actually include those questions, but certainly it would be something worth following up on. And as I mentioned earlier, the lack of data being collected, administrative data being collected at the population level really makes it challenging to see whether or not our current interventions are working. Just with respect to what constitutes gender-based violence, essentially back to my earlier point, gender-based violence is a violation of people's fundamental human rights, and it occurs across Canada. It affects all people of all generations, ages, etc., locations, and socioeconomic status. And gender-based violence can include physical, sexual, social, other types of harassment, abuse, and neglect. And as we see with pandemics, there tends to be an upswing of gender-based violence. Current housing policies and approaches, I think, are insufficient to actually address this pandemic and the situation that it's creating for vulnerable populations. So we know that seniors, for example, including those within the lesbian, gay, bi, trans populations, refugees, women fleeing from domestic violence, require urgent policy attention, such as more affordable housing options. We know that the National Housing Strategy, as well as Women and Gender Equality Canada, speak to housing as a right, and that's an important statement to make publicly. However, what's missing is a better partnership or a more obvious partnership between both the National Housing Strategy and Wage to work in partnership to ensure that the rights-based policy rhetoric actually yields appropriate and tangible outcomes. And we need to, in other words, address gender-based violence across sectors and not simply in silos. By way of conclusion, I just want to suggest that we do need to recognize and act on the ways in which vulnerable populations, variably defined, gender-based violence and homelessness are inextricably linked. And as a result, we need both the National Housing Strategy and Wage to commit to ensuring both policy and programming responses based on the Canada, Government of Canada commitment to gender-based analysis and housing as a human right. We need to have a better commitment to data collection, as I mentioned before, and as noted in the National Housing Strategy, we don't have great data to develop policies and programming and housing interventions. We need better policy analysis and program evaluation to ensure that the housing needs of the most vulnerable Canadians are being addressed. And just very briefly, by way of conclusion, I would urge people to have a look at this, and Shawn alluded to this in his talk. It is the Post-COVID-19 Housing Futures, a national call to action, and you can see the 8 actions are listed there. I don't have time to go into each of them, but I would certainly ask you to refer to that website and have a look, and if you're interested to sign on. And again, I would like to thank the McKechnie Institute for putting this important panel session together. And thank you very much for your time and attention.
Randy, you're all set?
Okay, hi everyone. Thanks a lot to actually Jackie as well as Kevin and Warren for organizing today's webinar, and really great to hear already from Shawn and Jackie, and looking forward to hearing from Linda as well on this really critical topic during COVID-19. So what I would like to focus on today as a planning professor here at the school, at Dalhousie School of Planning, is some of the policy responses that have been happening. So I have a couple of slides, kind of complex diagrams that I'll be showing a little bit later. But really what I want to focus on today is three gaps that in our housing system that I think have been really exacerbated by the COVID-19 pandemic, and how I think that some organizations have really risen to the challenge of that, and have been a real opportunity to develop some solutions to these problems as a response to COVID. And what I want to talk about then is, how can we maintain that kind of innovation in our solutions to these problems? So I really want to talk about three gaps. The first, I would say, is vulnerability. The second is stability, and then the third is discrimination. So the first one, I think that both Jackie and Shawn really touched on already, which is that a real gap in our housing system is the ability for people who are vulnerable to, as a result of things like mental health issues, addiction, gender identity, age, who are really vulnerable and really can't find housing in the kind of market system, and who also maybe need support of some sort in order to live. And so what we're seeing right now, the real opportunity that we're seeing and the response has been some increase in federal funding for organizations like food banks, for United Ways, for through specific programs like the Reaching Home program to access seniors. Funding for Women and Gender Equality Canada, Indigenous Services Canada to maintain operations at their shelters. So that has been one response that we've seen in basically an increase in funding from the federal government. We've also seen from municipalities a lot of I think pretty innovative approaches to dealing with people experiencing homelessness and violence, which is leasing hotel rooms and making those available for people who need to self-isolate, or to help shelters actually accommodate social distancing because they're so overcrowded that there would be no other way they could do that otherwise. And so we've seen the use of community centers, convention centers to be able to do that. We've seen temporary shelters in Montreal, even outdoor kind of areas that have been set up for people to actually access the services that they need. So there has been a tremendous response, I think, particularly from the nonprofits and the municipal government, so at that local level. In terms of what that might mean after COVID, I think that the real challenge is that this level of funding will probably not continue. And so how are we going to be able to kind of continue to offer the services that are so badly needed to people who are the most vulnerable? So we'll always need temporary shelters, and that is definitely part of the call to action that both Jackie and Shawn mentioned, is that there is always going to be a need for some shelters, but we really need to move people into permanent housing, people who are vulnerable. So that means a lot more funding for social housing or public housing with supports. And that could be obviously municipalities then are, if they are to be major players in this, they need the ability to borrow money, to actually tax, and to be able to legislate to make those kinds of actions happen. I think Shawn mentioned we also need better data. Municipalities need better data, and provinces and municipalities should be actually reporting on the number of units that they have available and that they created each year. So I think that's pretty critical. So I'm going to share my screen with you now just to show the second gap here. So this is a bit of a timeline of the actions that have been taken in response to COVID. So the top half, the green, are the federal responses, and then we have the blue is the provincial responses, and the orange is the municipal. So I really just wanted to put this up there so that while I'm talking, you can kind of see a little bit of what I'm talking about. The second gap I wanted to talk about is stability. So we know that a lot of Canadians are very close to losing their housing, whether that's homeowners or renters, and we also know that commercial tenants are also very close to losing their properties. And that's really why we've had to see things like deferrals on mortgage payments. Renters have been protected by partial bans on evictions in every province and territory. In some provinces and territories, they've introduced or expanded their rent supplements so that more people qualify for those rent supplements. And BC, Alberta, and Manitoba even froze their annual rent increases. In terms of most people, of course, have access to the CERB, and some provinces have even introduced one-time benefits for workers. And then for commercial tenants, a little bit later in the game, I think the Canada Emergency Wage Subsidy is now helping to offset business losses. And just recently, last week, we saw an emergency commercial rent assistance program for commercial renters, for businesses. And so I guess those are the real innovations that have been happening in terms of what we could see, how these kinds of actions could become permanent. We could see stronger regulations on evictions that could prevent renters from losing their houses or their apartments due to demolition, to short-term rentals, or to renovations. So we really do need better protection for tenants. The other thing we could see is some sort of universal income for anyone who can't work in the coming year. And then for commercial tenants who have always faced kind of the loss of their spaces due to gentrification, we could actually see funds that municipalities might develop, or municipal or business organizations, that they could assist these businesses in actually retaining their properties or their rental, their lease spaces. And then finally, this is the same diagram, I just color coded it differently to illustrate that I think discrimination is the final gap. Basically, what we've seen here if you look at the timeline, I know it's really complex here, but let's go with the colors here, which is that the green indicates supports for homeowners, the blue indicates supports for renters, the orange for vulnerable groups other than renters, and then the purple is supports for businesses. So if you look at the federal timeline then of actions that have been taken, you can see that the very first thing that they did was to announce deferral of mortgage payments, which would benefit, of course, homeowners. Then after that, we saw supports for the more vulnerable populations and for businesses. And for some of the vulnerable populations, such as seasonal workers and students, we only saw action in the last week. or some supports introduced in the last week. Whereas if you look at what the provinces and the municipalities are doing, it's a little bit different. So, self-isolation funds were actually started by some provinces very quickly, Quebec, Alberta, and Saskatchewan. That was before the CERB came in. We're seeing some provinces freezing annual rent increases, banning evictions. That came at the end of March, so about 2.5 weeks into the pandemic. Some support for businesses also starting fairly early on there by the provinces. So, and municipalities, of course, the orange two sections at the bottom, starting very early in assisting people experiencing homelessness. So we're seeing, I think, that at the federal level, the attention has the first attention really was to homeowners and to the CERB, which would benefit everyone. And later we saw responses for the more vulnerable groups. I think as the National Housing Strategy indicates that, we really should be focusing, and we have made this commitment to focus our attention and our funding on those vulnerable groups. And so I think it does illustrate our sort of the kind of discrimination that does exist there, in that we actually thought of homeowners first instead of people who were more vulnerable. Okay, so that, I guess to conclude, I will put up the call for action as well. That's the link. I think Jackie had it as well in hers. But take a look at that. I think that it covers a lot of the issues that many of us, or probably all of us, will be talking about today. So there's been a lot of innovative actions that have happened already, and I think we really need to think about how we can make some of those, or hopefully many of those, permanent after the pandemic is over. Thanks a lot.
Okay, Linda, you should be good to go.
There we go. Hi. Am I ready to go? I hope so. Okay.
Yeah, all set. We can see your screen. If you just full screen the slides, we should be good to go.
Okay. Good evening. Tonight, I'd like to begin by thanking and sending my admiration to all my colleagues at Shelter Nova Scotia, who are working carefully and thoughtfully through the COVID-19 pandemic to keep our clients, their colleagues, and themselves safe. It hasn't been an easy time, and they've been at it 24 hours a day, every day since this began. I'd also like to thank our partners in the community and government, most specifically Phoenix Youth Programs, the Salvation Army, ADSUM for Women and Children, Out of the Cold, Housing Nova Scotia, North End Community Health Center, and MOSH, their Mobile Outreach Street Health Team, Public Health, Housing Nova Scotia, the Affordable Housing Association of Nova Scotia, and the United Way of Halifax, for working with us and our clients to find solutions and safety for the folks we serve right now, and being concerned for all of us who are involved. It's been a complicated, scary, and trying time. Most recently, the Canadian Alliance to End Homelessness made a very simple statement. The best protection against COVID-19 is a home. It's not complicated, but it's very complex. Thank you for the opportunity this evening to speak a bit about the issues with this panel of experts. I'll speak broadly and then specifically about some of the work at Shelter Nova Scotia as it relates to our housing and homelessness sectors of the organization. But I would also, before I begin, really like to thank our board of directors, volunteers, and generous donors who, for no other reason than that they want to be part of the solution to ending homelessness, are involved and engaged and help carry the load in many ways every day. It's become accepted and understood that a housing first approach to ending homelessness is the way to go. The old ways of having people prove themselves by applying for jobs and getting employers to sign documents saying that they dropped off resumes, or staying clean and sober for a certain amount of time, or going to detox before you could even be considered for housing, are no more. It's now understood that by transitioning from homelessness into a stable home first, a shift in perspective can result. When people are no longer in day-to-day survival mode because we have a place to call home, we can move to envisioning a different future. When life circumstances evolve to a point where a person no longer has a place to live, they can experience homelessness. There are some really broad causes for that. Lack of affordable housing, unemployment, poverty, mental illness, and substance abuse, and the lack of services for those issues. And then there are very specific reasons within those causes, which would include a change in home dynamics or escalation of a familial circumstance, the living realities of living in poverty and social isolation with low levels of education, being unemployed or having precarious employment. There's a lack of support services for people when they're discharged or transitioning from residential settings or services like child welfare systems, mental health systems, or military life as examples. There's also a migration from rural communities toward urban centers in search for employment or better services, or even a fresh start. So societal stigmatization and stereotypes and discrimination resulting in social isolation because of barriers to mental health barriers, substance and or gambling dependency, and a lack of adequate services, race, faith-based practices, age, sexuality, gender, and national origin are all issues that could cause a person to experience homelessness. At the end of the day, however, no matter what the circumstance is, the shortage of affordable supported housing is the reason that people are experiencing homelessness. There are definitions being used in Canada to describe states of homelessness. There are three, as you can see there. They're transitionally homeless is a short-term state, usually less than a month. It could be a once-in-a-lifetime experience. Episodically homeless are those people who move in and out of homelessness throughout their lifetime. And then there are chronically homeless people who experience homelessness for more than a year and often for decades. What you'll see there on your screen is a summary, a chart of that was created after the 2018 point in time count that took place in 61 communities across the country in March and April 2018. There was another scheduled for this year around this time, but obviously it had to be postponed. You'll see the information captured by Reaching Home, Canada's homelessness strategy, captured what they call a snapshot of the realities. And if you're interested in seeing the specifics that were gathered in HRM by the Affordable Housing Association of Nova Scotia, you can go to their website and find their report called Everyone Counts, Report on the 2018 Halifax Point in Time Count. So where I work right now is Shelter Nova Scotia, and we have a series of programs. The building you're looking at right now is Barry House, which is an emergency shelter for women. It's a circumstance where there are 20 people sharing 6 bedrooms. And you can see from this picture that it's more of a home-like setting. Guests are at least 16 years of age or older. They could be single, they could be families, youth, senior citizens, people living with mental health concerns and disabilities, unemployed or underemployed, and they could be struggling with substance misuse, post-traumatic stress, abandonment, rejection, and poverty. Similar circumstances, but a very different living situation is what men are faced with. So that is Metro Turning Point on Barrington Street, where 55 men and trans individuals share 2 dorms. As you can see from these pictures, it's not a home-like setting. It's crowded. That bed in the front there, you can see a number 32 on it, which means that that bed also coincides with locker 32. So everything a person has is between that bed and a locker. This is a picture of one of the rooms in the shelter in the door. There's 2 dorms. This is one of them. And what it looked like before COVID-19. Altogether, as I mentioned, there were 55 beds. Now in this circumstance, their province, specifically Housing Nova Scotia, has opened 3 what they're calling pop-up shelters to help reduce the overcrowding. So now currently there's 30-minute Turning Point and 12 women at Barry House as opposed to 20. So Maslow's hierarchy of needs is something that some people are familiar with. Maslow stated that people are motivated to achieve certain needs and that some of those needs take precedence over others. Our most basic need is for physical survival, and this will be the first thing that motivates our behavior. Once that level is fulfilled, the next level up is what will motivate us. So with this in mind, you'll understand that most often when we meet people, they're not even on the bottom level there. They're below the bar, below that physiological bar. They don't have food or water or a place to sleep. They often have no belongings, and they're wearing all the clothing that they own. Often all they have is connected to this measurement tool is air. They're breathing. They have no sense of safety, no sense of love and belonging or self-esteem. This is not to say they never have or they never will again, but at the time of experiencing homelessness, most people have nothing. So when you hear comments about why don't those homeless people go home or why don't they just get a job, you see it's impossible when they can't meet their most basic human needs and they're in a constant mode of survival. As I mentioned at the beginning, it's become accepted and understood that a housing first approach to ending homelessness is the way to go. The old ways of having to prove yourself in ways measured by the middle class before you can be considered for housing are no more. Shelter Nova Scotia, I'm pleased to say, has a supported housing program, a housing support program in the community, a trustee program, and a housing first program. What you see on the screen there is a building called The Rebuilding. It was named by a tenant in 2012. The tenants are men who have experienced homelessness, either episodic or chronic homelessness. For some people, that's permanent housing, and for others, the units are used as transitional housing for those who are able to live with less support after stabilization. This is just a couple of pictures of what an apartment would look like. There's 19 one-bedroom or bachelor apartments. There's a case manager on site for 16 hours a day and on-call support available 24 hours a day. Heron Cove Apartments is our housing first model, opened in 2015 out on the Heron Cove Road. It provides stable supported housing for people with alcohol dependency who have a history of chronic homelessness. So in this case, you can see there's a capacity for up to 12 tenants. There's 4 apartments, each with 3 tenants. Each person has their own bedroom, and then they share the living areas. It's staffed full-time and provides on-site support. So what we would all like to see, probably right across the country, but certainly in Nova Scotia and absolutely at Shelter Nova Scotia, is a best practice, evidence-based triaged approach that would use housing first and integrated services. People are different, their circumstances are different. What's going to work for one is not going to work for others. So there's going to always have to be a combination of emergency shelter beds, but with a hope that people would move quickly into more stable permanent housing. So for some people, it just might be rooms. It might be a supported boarding house model. Others, it could be places like I just showed you, supported affordable housing for people who have been experiencing transitional or episodic homelessness. There absolutely has to be aftercare and outreach to mitigate social isolation after people are housed, because loneliness after people get housed is often something that will bring them back to the shelter. In terms of integrated services, there needs to be physical health, mental health, harm reduction models that would include managed alcohol, safe injection, detoxification services, and recovery support, along with, of course, extreme weather services. So although we have some good services happening now for sure, and there's lots of promise, it's not nearly where it should be. We've always used words like crisis, emergency, undignified, and disrespectful to describe what happens when people have to go to shelter. And some people refuse to go to shelters. They just stay outside. So what COVID-19 has done is shine a brighter light on the issue. Overcrowded shelters where people cannot self-isolate has created chaos and fear and a temporary crisis response that's very noble, but it's not sustainable. We were not ready for this, and it didn't have to happen this way. But what I know for sure is overcrowded shelters cannot exist after this. People must have places to live. Thank you.
Okay, thanks everybody. I think I'm back on now. Thank you to our speakers for their thoughtful comments. I'd like to invite our audience to send in any questions that they might have. I'm just going to make one little condition, I guess, as we start. We like people to ask questions of a particular participant so that we can get as many questions in as possible. So if you can identify who you'd like us to ask the question of, we would appreciate that. For the panelists, there's a little bit more flexibility in the sense that you can pick up any question that you'd like. So the person who receives the question will hopefully answer the question. Anybody else who wants to comment is free to do so. But we ask that you, when you send your question, and you direct it to one person in particular. And so, and again, that's at mipp@dal.ca for those questions, or you can post them on our Facebook during the live stream. Warren McDougall is going to send those questions to me, and I'm going to ask them of our panelists as they come in. But before we start, I'll just, I think I'll start us off while people are putting their questions together. One thing that I wondered about, so all sensational presentations with lots of great ideas. I have a couple of things sort of floating around in my head, and I think one of the aspects that I wonder about is this a bottom-up problem and solution, or is it top down? We've talked a lot about government interventions and policies that are required, but I'm also wondering to what extent this solution really fundamentally requires different attitudes, different mobilization on the ground in order for those leaders to make those decisions. So I'm going to cheat, break my rules right away, and throw that out to anybody who wants to answer it. I would be grateful for a view from anybody and everybody if you have a view on whether this is bottom up or top down. Go ahead, Jackie.
So thanks for that question. I think it's a combination, not to simplify the complexity, but I think from my perspective, the whole COVID-19 overlay in relation to housing really speaks to the failure of, I'm going to say, government to make a firm and long-standing commitment to this issue. So in other words, to Ren's point, why was the trajectory of aid and policy decisions being driven by, let's say, market forces, so people that can afford to own a home, or people that own a commercial business, as opposed to saying there is a crisis in Canada and there is plenty of rhetoric around so-called vulnerable populations and the need to ensure that they have a safe place to live. If that is truly a commitment that Canada embraces, there needs to be a firmer commitment and not just responding to crisis mode when these kinds of unfortunate global incidents occur. So I think it's both top down and bottom up.
But do you think that has been, that's the accepted view then, that fundamentally that there is not sufficient recognition at the bottom end on this in our communities? There's not sufficient recognition that this is an ongoing crisis that has been brought maybe more into focus during this particular period. but really politicians will respond to community support and urgency. So I wonder how, do we need more urgency on the ground to say this is a priority for our communities?
I think if you look at the history of all of these kind of innovations in housing, you do see that there's always been a community, there's always been a bottom-up response. There's always been charities, there's always been faith-based organizations, there's always been basically non-governmental organizations before there was municipal governments, really. And so they were actually the kind of, I guess, forerunners there in actually providing services that weren't provided by municipal governments at the time, because we didn't have municipal governments we're talking about in the Victorian era. So I think there's always been a bottom-up response to local conditions, especially things like housing quality when people's health is endangered. So housing for workers, housing for vulnerable populations has always been a focus of the bottom-up kind of the groups. I think that what really was only in times of crisis, typically that is when our government and a lot of developed nations governments have acted, is during wartime, in other moments of crises, economic crises, prolonged economic crises, those kinds of issues, or those kinds of times. So I think that government right now is acting to stability. And so looking at those three gaps that I talked about, which was vulnerability, vulnerability, and then stability and discrimination, they're addressing some of the issues of vulnerability, but really their main focus has always been about kind of that stability, making sure homeowners and trying to get more people into home ownership. And this has always been kind of that, and that ties into the discrimination factor too, that is really what the priority of our government has been, is the more commercial, and Shawn touched on this very early on there, the kind of commercial side, the market side of housing. It's unfortunate, but I think the only reason we're seeing this kind of action right now is because everyone is affected. As Linda knows very well, and then lots of people work it, this has been a crisis. We've had this crisis in homelessness for 25 years. Mm-hmm. So now we're seeing this huge innovation by local providers, but also some additional funding from the federal government, only because everyone is affected, I think.
Linda or Shawn on this point? About the dynamics that are required to bring about change?
I would agree. Unless the politicians are made aware by the taxpayers that this is important, it will remain an issue that's very popular at holiday times. I mean, if we were able to get the support and attention that we get at Christmas time, the rest of the year, I think the problems could all be solved. But I still think that there's too much, instead of a social justice approach, there's a charitable view of it, and that we need to kind of take care of those poor people at different times of the year, but not, make sure they have mitts and hats and scarves, but a place to live. I don't think people really think about it that much, or they make the assumption that people want to live that way, and it's not the case. So I think until the general public becomes really aware of what the issues are, and then votes that way or talks to politicians that way, it's just gonna be more of the same. However, what I do know is this big scramble to reduce the numbers in the shelters right now is really to make sure the rest of us don't get sick. That's how I see it.
So. Yeah, I'd reiterate that. I think this is one of those sort of many big ticket items, or costly social policy areas that the government is quite happy to leave to others, to leave to the private sector, to leave to community groups. And I think it needs to be both bottom up and top down. And hopefully with the National Housing Strategy, there are potentially now some new tools to be able to sort of leverage some action in both directions. But it really speaks to the need to reorient, I think, what we consider to be enforceable rights in this country.
Okay, I have a few questions that have come in, so I should get to them. Otherwise, we won't get through them. So, and I'll become very unpopular with the people watching. It's a question from Diane for Ren. I'm going to read it, and I hope it's clear. So it's regarding Ren's presentation. Homeowners were not necessarily prioritized, but the mortgage deferral tool already existed and was quick and easier to deploy. Other responses needed development and approval. Perhaps it points to the fact that these tools also need to be in the toolbox for future quick deployment. Any comments on that?
I mean, I think that makes sense because, like I said, I mean, since we have prioritized housing, like home ownership for the last 80 years, really. So it kind of makes sense that the kind of easiest thing to do was for CMHC, for the federal government to coordinate with CMHC and the banks like that kind of does make sense that there was already a tool available, but that is kind of problematic, really, when you think about it. It's like, well, that tool was readily available, but provinces had to integrate or had to start their own temporary rental supplement programs. Like Northwest Territories had to expand their program, the eligibility, so that more people qualify. Like, why is that on a province by province basis, right? Like, I mean, there should actually be, I understand that it wasn't available or it wasn't in place, but again, learning from this is so can we now put something in place which makes it possible in the state of a national emergency like we have now, that there are these other tools that we can implement right away. And so that's emergency funding for shelters or to support people who are vulnerable, as well as things like emergency rent supplements or emergency banning evictions, for example. Like those tools should be as readily available and as quick to deploy as a mortgage deferral was.
Let me just ask a follow-up on that then, Ren, because we have a sort of similar question. How do we make sure that changes this is from Francis on email, how do we make sure that changes enacted during the pandemic, tenant protections, adequate income support, adequate long-term care staffing, become permanent? We don't slide backwards austerity-wise in the scramble to recover economically.
I think this is, again, where we're going to see the need for bottom-up action, where we're going to need to see housing advocates, municipalities, United Ways, like those groups who are really involved, who have seen the benefits of these, and provincial governments as well, who have quickly enacted, as quickly as they could, enacted these new policies or made changes to their existing policies. We're going to need to see them advocating to keep those. And looking for new tools, new funding tools, or new support in order to, maybe through the National Housing Act, to a strategy to be able to make those things permanent. So we know that we need better tenant protection. Like that's been an ongoing issue for many, many years in Canada, that tenants are quite vulnerable. Like it is fairly easy to evict a tenant in Canada compared to a lot of countries in Europe or in Asia, other places, right? So and there are a lot of people who have been advocating for better protection for many years. So I think we need to use this. We need to use the innovations and keep on talking about the innovations that have happened during this time to our governments, to the federal government, to CMHC, so that we can continue those after COVID, and that's the tenant residency boards and all of those as well.
Anybody else on the question of not rolling back? How we any momentum that we might have shown that we want to maintain? Any thoughts on that from anyone else? I'll leave it with you. I've got one for Linda. Linda, this is from Caitlin on email. Are there jurisdictions that have been effective in addressing homelessness or housing more broadly? If so, what lessons and practices have you seen that could be effective in Nova Scotia?
Yes, there are. Different municipalities or cities have taken different approaches to really truly accepting a housing first model, which means truly accepting people as they are and making sure that they're housed first. So I think of Ottawa and Medicine Hat, just off the top of my head. They do have managed alcohol programs, for example, which keep people safe. And they have models where there's peer support within their apartment services and things like that. And I think that we know what to do. We know we've got all the research. We know what to do, but we haven't. And I would say we are at the very early stages. Maybe, no, you know what? Maybe we're 30% there, I would say. But there's a lot to learn from other parts of the country. And I think we need to decide what we're going to do first. But one part that I think is happening this time, I think one of the benefits of COVID-19 is that there seems to be officially a health response, a public health response to this, because I think homelessness is seen to be a community service or a housing related issue, but it's also a health issue. And those things have to happen together because people often can't keep their housing if they don't have health services.
Thank you. A question for Shawn. It's from Nina on Facebook. I believe in your last slide, you had an image of Salis on something that needs to be avoided, quote unquote. Could you please elaborate what's not appropriate about the project in your opinion?
Sorry, could you repeat that?
I believe on your last slide, you had an image of, I'm going to say Salis, Salis, S-A-L-U-S, as something that, quote, needs to be avoided. Could you please elaborate on what's appropriate about your project, what's not appropriate about that project in your opinion?
I'm not sure to what that's.
I think it was a photo there. It was a couple of photos, Shawn, of buildings. Yeah, that one. Maybe.
The images actually were just to demonstrate the difference in how we might approach housing. And so if we think about quality of life for people in acute sort of precariousness, what tends to happen is they tend to be put in conditions that still aren't that great. And so there are opportunities, I think, to build infrastructure that is supportive of health for vulnerable populations that are sort of more than the bare minimum, and that speak to other issues that are influencing our health. So if we think about the ecological context and climate change, what do we need to build into our health supporting structures that will facilitate better outcomes in that regard too. And so I've just shown pictures here of some of the ecological architecture that's being pursued in different places, and how we can be a lot more innovative in where we put people even.
Okay, I think this is a question. This is probably a question for everyone, if you'd like to chip in, but I'm going to start with Jackie because Jackie spoke specifically around data and the importance of data collection. So this is from Janice on email. Given the importance of data and the need to identify particular gaps, could someone comment on what key areas of data we need to capture during COVID-19? Is data being captured to help planning around housing and other factors, other social factors?
Yeah, I mean, I think the issue about data was illustrated in the National Housing Strategy, where they actually said, and I believe it's on page 27 of the National Housing Strategy, where they talk about vulnerable populations and not having sufficient data to inform policy and programming decisions. So on the one hand, you have the National Housing Strategy being unrolled or nationally, and there's still this conceptual and methodological issue about what kind of data are being collected that would actually fill those gaps so that those historically marginalized and vulnerable populations that are alluded to in the National Housing Strategy are actually being captured. So, Statistics Canada, the General Social Survey, I mean, there are a variety of population level and administrative data mechanisms already in place. So I'm not by any means suggesting that we need more federal or provincial machineries collecting data, but I think we actually need to do better with the administrative data that are being collected. And I had somebody ask me a question about, what data are being collected during COVID-19, and there was an interesting paper that came out recently from the WHO about the dangers of collecting certain types of data during a pandemic. And in part, this was in relation to the potential for escalating gender-based violence and the dangers of, for example, in some contexts, doing door-to-door surveys or other types of data collection mechanisms that could actually trigger incidents of violence or other challenges. So I think what I'm talking about is that we have federal and provincial mechanisms in place to collect data. If the National Housing Strategy is already noting those as gaps, then at the very least, those mechanisms that are being funded from, let's say, tax dollars are actually collecting the data in a way that can be can be connected into those vulnerable populations that the National Housing Strategy is basically saying we don't have enough data to make informed policy and programming decisions. That to me is shocking. I would say that we're in 2020 and we still are making the claim that we know that there are particularly vulnerable populations, but we don't really know with any great specificity what their housing issues are. We've heard from Linda. We do kind of know what those are. Point in time surveys are great, but there's also a broader infrastructure of data collection that could weigh in on this and do a better job and get greater granularity. Like, are we collecting information about LGBTQ folks? No, that's noted as a knowledge gap and a data gap in the National Housing Strategy. I don't believe those data are being collected. We've collected some of that data, but it's being done in a very sort of patchwork way, which doesn't give us a national snapshot of what is really happening. The work that Liesl and I and others have done in the EU, they actually do a better job of collecting that data. And interestingly, there's portability of those benefits, housing and other social benefits. We don't have that here. So I don't actually know, is British Columbia a better place to retire to? I'm guessing not by the price of real estate, but we don't actually have a good sense of whether there are safe, affordable spaces for historically marginalized populations. And I think we can do a better job. We know that housing is a crisis in the North. We need better data and we need better action based on that evidence to make those evidence-based decisions. And I mean, I'd be happy to hear other people's thoughts on that. I could talk about that for for a really long time, but I'll leave it there. Thanks.
Does anybody else want to comment on data collection?
I would just say that municipalities, often, including very small municipalities or even mid-sized like our own here in Halifax, really don't have a lot of resources to actually collect the data that they need to. So even on their own the outcome of their own policies. So for example, if there's a new policy on secondary suites, for example, or on short-term rentals or something like that, it's very hard for a municipality to actually, then keep track of the number of units that are being, that maybe there's permits involved or something like that. Like, you'll see that for the most part, mid-sized and smaller cities are just not able to do that. They just don't have the resources to do that. And so if they're going to have the ability to know how many units they have or need to create in the coming years, they need actually some funding or like basically staffing support to be able to do that, because it's really, and enforcement is also another huge problem, as we know, for like public safety and renter protection and that. Like, it's very hard for small to mid-sized cities to actually enforce those kinds of policies that they actually have in place. So they might actually have some really good, protections or conversions, kind of bylaws in place and that kind of thing. But it can be quite difficult to actually monitor those without extra staffing support, extra resources.
Okay.
And just as the last point on the data issue, another big problem is that different parts of government collect data and don't speak to each other. So we have all kinds of data that we just can't access, or we can't put together with other data for privacy reasons or for data architecture reasons. So that we can't have these full pictures because we're not using our data very well, and we've siloed our data so badly.
Right. A question from Jesse on Facebook for Ren. What are the factors that lead different levels of government to respond differently or at varying speeds? Did one level of government do it best? What can we learn from the comparisons?
Well, I think that housing is obviously, it does involve all three levels of government. And partly the reason is because provincial and federal governments can run deficits, but municipal governments can't. And that gives them, it gives the upper two levels of government then more ability to create programs that can fund the development of new housing or expand what we already have. But they need the municipal governments to identify the locations of those, how many units are needed for which demographic groups. So that kind of local knowledge has to come from the municipality. So it really, you know, even in the era of like urban renewal, where you saw huge amounts of funding going into public housing, and that was provincial federal split of funding, municipalities actually weren't contributing that much there. There was, in that case, you know, there is a lot of funding available. There's a lot of innovation research funding that through the National Housing Act, through CMHC, that we have access to. But the problem there was that without consulting municipal governments, you ended up with these kind of projects that were really, you know, ended up being not very good for communities, because they destroyed communities, they concentrated people all into one area, all of these issues that we know. And that's why we turn to more community-based and local-based types of solutions like co-ops and all of those kinds of, where we had a lot more municipal involvement. So I think the answer is, unless municipalities suddenly have more ability to tax and borrow money and be able to run deficits, then they're not going to be able to actually provide like the housing that, or they won't be able to fund it. They could provide it, but they'd have to get the funding from the upper two levels of government. That's really the issue. And sometimes there's jurisdictional, like there's just like in terms of their responsibilities or abilities, they're actually limited. So we have that issue, and most municipalities are limited by their provincial planning acts in what they actually can do. So there's jurisdictional issues too, as Shawn probably would say.
A question from Logan on Facebook for Jackie. Given that public policy is often preoccupied with the needs of the majorities rather than vulnerable minorities, what lessons can we learn from past successes in empowering minorities, civil rights movements, for example, that we might apply to enhancing housing? And what makes housing different from these past successes?
Thanks, Logan, for that very easy question. It's complicated is the answer. So, you know, I think there are some successes, and we see social movements whereby communities rise up and challenge government assumptions and push government to change their thinking on particular issues. Harm reduction is an example. You know, one of the most evaluated programs in the downtown east side of Vancouver, doing really great work in terms of harm reduction, and yet it was challenged by virtually every level of government to get rid of it. And there was also community support to get rid of that program or to move it someplace else. So I think the fact that we're now seeing all levels of government supportive of harm reduction, I think there is the possibility, and again, it speaks to, I think, the first question that was asked by Kevin, which is, do we need more of a bottom up or top down? I think we absolutely need both. We need community mobilization, but we also need allies within all levels of government to shift the discourse and change the direction that we can take. And there are many examples where the policy discourse has changed because you know, government and community agree this is for the good of the community, broadly speaking, and so those shifts change, but it takes time. And I think we're seeing this as an opportune moment to rethink the policy discourse around vulnerable populations and their need for housing. If we actually, as a country, believe that vulnerable populations, as does everybody else in the country, have the right to safe, affordable housing, then make it so. And it's a collective top-down, bottom-up effort. And I think this COVID-19 situation is the impetus for a major rethinking of how we approach housing nationally. So I'm hopeful that we can shift and make that change happen. But it's top-down, bottom-up.
I want to just bring Linda in on this question, if I may. Linda, do you think that this a particular episode of COVID-19 is leading to a different attitude towards homelessness, or this is essentially the same attitude? This is sort of, as you said, sort of donations at Christmas sort of notion, or do you think this can lead to something more profound?
I think it can lead to something more profound, just by the way people are acting so quickly, are moving so quickly. There was no question. I think everybody has believed that the shelters were overcrowded, but there was no question that the numbers had to be reduced quickly to take care of the situation. I think I also said I've never seen such a collaboration together that included health. Health always seems to be kind of on the periphery of the issue, and they're right in there. And I think maybe they see now that homelessness is a health issue. The other thing, when I talk about donations, we received more money in the last month from donors who want to provide food or clothing or whatever it is for people while they struggle through this than we ever have in a 1 month period. It's shocking. And for me, when, money talks. So I think when people donate money, it's because they must believe in what's happening and they want to support it. They're like votes of confidence. So I think by virtue of the number of members of the general public that have come forward and donated to us, the fact that the Health and Housing Nova Scotia are working with the different community agencies. And I would say that we as community service providers are working more closely than we ever have. So I think the ability is there. I really hope that we don't lose steam when all this is over, because I'll tell you, everybody's exhausted. Everybody, since March 17th, I've had 2 days off, and they've been 12-hour days. And I know that all my colleagues, and I would suggest those people in Housing Nova Scotia and Health as well, are doing the same. I just hope that we're all so tired at the end of it that we don't let it go.
Two things. One, how do you sustain it? And two, who else has to be involved? Who do you think is not at the table that should be at the table? And how do you sustain the momentum?
I don't know if the wrong people are at the table. I just know that everybody's put other things aside. I think it's how do you keep it a priority? And I just don't know. I think it's going to be it's going to have to be the general public that pushes it and keeps it a priority. I just don't know, because service providers have been pushing and advocating for, really, this should have been figured out 200 years ago. People should have had places to live.
Right.
Yeah.
Okay, I've got one last question. We're almost out of time. It's for Shawn, but it's a topic that's been coming up quite regularly, Shawn. So hopefully you'll have some thoughts on this. There's now talk of universal basic income. Does this dovetail into a right to housing, but puts it in the hands of the market and nonprofits? Thoughts on universal basic income, Shawn? And this is from Diane on Facebook.
Right. Well, so there haven't been many, I think, real efforts at designing basic income projects. There was a really good pilot in Ontario a few years ago that seemed to be working actually quite well, and then there was a change of government and the whole thing got shut down. But I think there's a lot of sound evidence that basic income programs work and are superior to what we've been doing in the past. And I think that model could very much be something that could help us think about how we deal with housing. But what it takes, as I think evidenced by the fact that the pilot program in Ontario was shut down, was it takes we need to shift our perspective as to what we think is valuable social investment. And so some of this has to do with the notions that I put on some of my slides about greater solidarity, about bearing costs on behalf of those who, at least in the short term, can't bear them on their own. So I think, and we'll have a better chance of designing these joint sort of projects if we include a greater role, I think, for public health. I think that's one of the reasons why some of the responses to COVID have been so successful, is because public health has sort of typically had a bit of an impoverished role in our health setting, broader health setting. And I think that some of the most impactful things that we can do to support health and to support well-being come through public health, but it requires public health partnering with these other sort of programs and these other bodies. So yeah, I think it's a model that could be useful.
I'm going to cheat and just run over a couple minutes. I got one last question. I feel remiss because we haven't actually addressed it explicitly, and I want to ask Jackie to maybe comment on this last question. It's from Jacqueline on Facebook. Have you considered, I'm asking you, Jackie, because I know you've done a lot of work with the elderly. Have you considered state of elderly in nursing homes as a form of homelessness? But perhaps just more generally, if you could reflect a little bit on the experience of people living in congregated livings who were elderly, and because we've seen such dramatic death rates in those homes, and COVID-19 has really brought a lot of focus to this issue. So I wonder maybe if you could just comment a little bit on that issue and whether this is a form of homelessness or insecure housing, or your thoughts on this matter.
Yeah, I mean, it's a really interesting question. And I think Carol Estabrooks recently just did a media release about this issue. Her work is in nursing homes and long-term care. And we've done some sort of end-of-life decision-making, including how people in congregate living manage. And, you know, if you kind of map long-term care facilities as a home, let's say under the National Housing Strategy, then people do have a right to a home, a safe, affordable home, let's say. And so we had this conversation earlier this week about, you know, is there a place in the National Housing Strategy to actually say these various places, even if they involve healthcare or health-related interventions, that's your home. That might be the last home you ever live in. And so, yes, it should be treated like a home, and that people in those facilities, whether it's long-term care or nursing home or palliative, that should be considered a home, and the same benefits and policy directives should be in place. It's your home. And so I think that's a really important question. And again, if you have the chance to Google Carol Estabrooks, you'll see she was on CBC. I think it was on Monday, talking about that very issue. I agree. It's an important issue. It is your home. It may be, as I said, your last home. And I think it does, from my perspective, need to be couched within that broader discussion about the National Housing Strategy.
Okay, thanks so much for that. And I want to thank all the panelists for their contributions tonight. Such an important discussion. And I know we could have gone on because we're just unpacking so many issues and there's so many more to talk about. I encourage the audience to get in touch with our panelists if they have any questions they want to ask them directly. I'm sure there's a wealth of knowledge here, and I'm sure they'd be very happy to share. Thanks for spending your time with us. To our audience and to the panelists, if you have any comments on the panel, by all means, please let us know. Next week, we'll be talking about the fisheries and the impact on the fisheries sector, COVID-19, and we hope you'll join us then. So at 7 o'clock Atlantic next Tuesday. So thanks again to everybody, and we will see you again next week. Thank you.